You brought up the University of Wisconsin. That sounds like a wonderful program that they have set up there for the Wisconsin for the Middle United States. I don't think Wisconsin is a very accurate comparison to Hawaii, personally, from my perspective.
There's some differences.
Yeah, there are a few differences. I think Hawaii serves more of an international focus, and we have kind of our own culture that we bring up, and we have our own different problems. We cater to a different community. And I heard that the School of Public Health, when it was a school previously, did a lot of international focus, and it was one of the premier places that you would come to for a broader-based public health educational focus. And I would really like to see that brought back. I think that we have a very unique environment and unique opportunities to work with different people. And as far as increasing economic efficiency, I think that's wonderful, all about efficiency, especially in econ. And stability, I think that as a School of Public Health, we would be able to do that more independently. I think that we have our own stability, and we have a lot to offer the world and a lot to offer the community. And thank you very much for all your wonderful points, and I'm going to try to keep this brief. So thank you very much.
Next up we have Charlene Charisma. She's a third-generation Filipina in Hawaii with public health roots tracing back to Hawaii's immigrant labor history. She graduated from the UH School of Public Health in 1981 with a focus in health education. Happy to have alumni back always. Before closing the School of Public Health, she coordinated the Health Careers Opportunities Program to provide access to underrepresented students and to bring assets of diversity in the public health professions. She's currently the Community Director of ANCART, the Asian American Network for Cancer Awareness Research and Training. So happy to have Charlene here, and she's prepared a PowerPoint with us. Thank you.
Yes, thank you very much. Hedges, I wish you aloha and mabuhay. I really appreciate the vision that you laid out. And at the same time, I'm very concerned about the transformation process of melding the best and the brightest, because it is no accident that it is this combination of people who have had an opportunity and a privilege to arrange our day so that we could be here. And I see a former faculty here, Dr. Patrick, Dr. Isutsu. Unfortunately, I was not able to take your class. I was in health education, and the Berkeley, the Berkeley Five is not here. And it was 27 years ago that I stood in this class, this room, and I was pregnant at the time, and my son went to high school right across the way there. But one of the guiding principles in this handout on transforming the University of Wisconsin School of Medicine and Public Health, some of the guiding principles made me reflect. Number one, we will not establish an independent, freestanding School of Public Health and then attempt to build bridges between it and our school. And I think you laid out some of your vision on how to do that and how to operate out of our silos. Number two, we will dismiss preconceived notions about public health and medicine, fields that historically have functioned independently, and will use our new integrated model to solve our most pressing health issues. And number three, we will increase levels of bilateral interaction with communities, local and state government agencies, and other organizations across the state, as well as with other components of our university. And there's more. But those three, when I was reading the material, having been born and raised here, and having gone to this school and this system in Hawaii since it was a territory, made me reflect on a Filipino proverb, and it goes like this: we can't get to where we're going without looking to where we came. And so in these few pictures, and it doesn't take very long, I wanted to bring our community here. I wear a lot of hats, and one of the hats I wear is with the National Federation of Filipino American Associations, and we are known nationally as a voice of Filipino Americans, and October is Filipino American History Month. We have been in Hawaii now for over 100 years. And it is in our dear interest to work collaboratively with you and all our leaders here today to begin to understand how we can describe health disparities, what it means to us from generation to generation, and where we want to go. And so this story that I'm about to tell is also variations of a theme of many struggling families and who make public health very important. We are doing a lot to build our young leaders. And we have formed a youth chapter to take a look at disparities. We are trying to empower them, like in public health. This is a community model, all volunteer work, to try to help our young leaders conduct needs assessments and then translate that to policies and be mentored with health professionals. We are building our relationships with elected officials, and Hawaii has 23 elected officials of Filipino ancestry. And the Filipino Legislative Caucus represents the largest caucus at the Hawaii State Legislature. And many of them are not ethnically Filipino, but they may be representing community people who are of Filipino background. And while we think about disease, immunization, prevention, emergency preparedness, and all of that, there are many other pressing issues. And in order to ask someone to get checked for prostate cancer, like these Filipino veterans who are in the high-risk group, and many of them are prostate cancer survivors, there is many work that we have to do, getting to know our congressional delegates, beginning to understand the issues of equity of Filipino veterans. And my question that I bring to this forum is, we cannot talk about health disparities without understanding the colonial roots and the colonial history of the United States and our global neighbors, and those of us who are privileged to have been born and raised here from those mother countries. And so advocacy for language access has become very, very important, even though it may not have important implications when you first look at it, when a young family comes to the doctor's office for immunizations and the doctor's trying to explain to the mother why your child needs to get tested for hepatitis and tested, or the risks and benefits of Gardasil for cervical